The PRIMO AirFloat overlay is a pressure injury prevention solution designed to redistribute pressure. The AirFloat overlay allows airflow to keep the patient cool, dry, and comfortable while in bed. Please note that while the AirFloat overlay has two different designs depending on the patient's specific clinical needs, the method for use remains the same. To begin, place the AirFloat overlay with the red CPR and inflation valves at the foot of the bed. Next, secure the straps under each corner of the main bed mattress. Before inflating, ensure the red CPR valve is securely closed. With the patient lying on the deflated overlay, use the included pump and place the nozzle into the clear valve. Inflate the AirFloat overlay to the number of strokes indicated. Once inflated, it is important to verify the patient is offloaded from the mattress by performing a hand check. The staff member should slide their hand between the AirFloat overlay and support surface beneath the sacral area. If offloaded correctly, the staff member's hand should easily slide underneath the patient. If it is difficult to slide a hand under the patient, the AirFloat overlay is underinflated and additional strokes of air are needed. If the staff member cannot feel the sacrum during the hand check, the AirFloat overlay is overinflated. Tap the flap inside the clear valve to release some air and re-perform the hand check. It is highly recommended to use 2 staff members for turning and repositioning a patient. Be sure to always follow your facility's safe patient handling protocols. To begin, raise the bed to the waist height of the shortest staff member. Next, lower the bed rails on the side of the patient where the staff member will be placing the wedge. In preparation for wedge placement, the staff member should grip the handles on the AirFloat overlay and pass the handles to the staff member on the opposite side of the bed. This gently lifts the patient. The black, non-slip side of the wedge should point towards the bed with the wedge handle away from the patient. Begin by placing the top wedge under the upper torso of the patient's body above the sacrum. Continue with the lower wedge under the lower portion of the patient's body below the sacrum. Gently lower the patient onto the wedges and ensure the sacrum is completely offloaded by performing a hand check at the patient's sacrum. For patient safety, raise the bed rails and readjust the bed height to its lowest position. Before you begin a lateral patient transfer, ensure the patient's safety. Make sure the patient's bed's wheels are locked. Raise the patient's bed to the height of the stretcher or gurney and lower the bed rails on the transfer side. Remove the AirFloat overlay straps from underneath the 4 corners of the patient's mattress. Make certain that the stretcher or gurney is aligned properly with the bed and its wheels are also locked. Using the AirFloat overlay's handles and standing on the same side of the bed as the transfer, both staff members will pull the patient from the hospital bed onto the receiving surface. For added patient safety, an additional staff member may be asked to supervise the patient transfer from the opposite side of the bed. When needed, the AirFloat overlay can be sanitized with antiseptic wipes. To receive information on cleaning guidelines, please contact your ASP Global representative. To find the best product for your patients, please call or visit our website.